I have been managing diseases without using a single pharmaceutical product, but utilizing purified drinking water, supplement played vital role in managing most of the diseases that are very prevalent today. So please join me as I discuss the medical condition known as arthritis and learn how proper hydration coupled with mineral supplementation help resolve the disease. A joint is where two or more bones meet, such as in the fingers, knees, and shoulders. Joints hold bones in place and allow them to move freely within limits. Most of the joints in the body are surrounded by a strong capsule that is filled with a thick fluid that helps to lubricate the joint. These capsules, with the help of the strong elastic bands of ligaments, hold the bones in place. The ends of the bones within a joint are lined with cartilage, a smooth but tough layer of tissue that allows bones to glide over one another. Arthritis literally means joint inflammation. Although joint inflammation is a symptom or sign rather than a specific diagnosis, the term arthritis is often used to describe pain, swelling, and stiffness in a joint. It can affect people of all ages, including children and teenagers. There are different types of arthritis. In some type of arthritis, other organs such as the eyes, heart, or skin can also be affected. The types of arthritis include ankylosing spondylitis, an arthritis affecting the spine. It often involves redness, heat, swelling, and pain on the spines or in the joint where the bottom of the spine joins the pelvic bone. Gouty arthritis caused by uric crystals that build up in the joints. It usually affects the big toe, but many other joints may be affected. Juvenile arthritis, the term used to describe arthritis in children. Arthritis is caused by inflammation of the joints. Osteoarthritis usually comes with age and most often affects the fingers, knees, and hips. Sometimes, osteoarthritis follows a joint injury. For example, one might have badly injured the knee when young and develop arthritis in the knee joint years later. Psoriatic arthritis, that occurs in people who have psoriasis, scaly red and white skin patches. It affects the skin, joints, and areas where tissue attached to bone. Reactive arthritis is pain or swelling in the joint that is caused by the infection in the body. One may also have red, swollen eyes, and a swollen urinary tract. Rheumatoid arthritis happens when the body's own defense system doesn't work properly. It affects joints and bones, often the hands and feet, and may also affect internal organs and systems. One may feel sick or tired and may also have a fever. In this presentation, I will only discuss the three common types of arthritis, namely osteoarthritis, gouty arthritis, and rheumatoid arthritis. In a healthy joint, the cartilage covers the surface of the bones and helps the bones to move smoothly against each other. This tissue is tough but smooth and slippery. When this tissue thins and the surface becomes rough, arthritis results. The joint does not move as smoothly as it should. When cartilage becomes worn or damaged, all the tissues within the joint becomes more active than normal, and the body tries to repair the damage. The repair processes may change the structure of the joint, but will often allow the joint to work normally and without any pain and stiffness. Osteoarthritis is the most common form of arthritis which affects any joint in the body. It may also be called as degenerative joint disease or wear and tear arthritis. It is most likely to affect the joints that bear most of our weight, such as the hips, knees, and feet, and joints that we use often in everyday life, such as the hands. In osteoarthritis, the cartilage within a joint begins to break down and underlying bone begins to change. These changes usually develop slowly and get worse over time. It can cause pain, stiffness, and swelling. In some cases, it also causes reduced function and disability, preventing some individuals from performing daily tasks or work. Signs and symptoms include pain, redness, heat, and swelling in the joints, trouble moving around, fever, weight loss, breathing problems, and rash or itch. The main symptoms are pain and sometimes stiffness in the affected joints. The pain tends to be worse when you move the joint or at the end of the day. The joints may feel stiff after rest, but this usually wears off fairly quickly once you get moving. Symptoms may vary depending on what you're doing. The affected joint may sometimes be swollen. The swelling may be hard and knobbly, especially in the finger joints, caused by the growth of extra bone, or soft, caused by the thickening of the joint lining and extra fluid inside the joint capsule. The joints may not move as freely or as far as normal, and it may make grating or crackling sounds as you move it, called crepitus. Sometimes the muscles around the joint may look thin and wasted. The joint may give way at times because the muscles have weakened or because the joint structure has become less stable. Any joint can develop osteoarthritis, but symptoms most often affect the knees, hips, hands, spine, and big toes. Knee, very common. This is probably because the knee has to take extreme stresses, twists, and turns, as well as bearing the body weight, often both knees. Hip, also common and can affect either one or both hips. The hip joint is a ball and socket joint, which normally has a wide range of movement. It also bears a lot of weight, equally common in men and women. Hand and wrist usually occurs as part of the condition nodal osteoarthritis. This mainly affects women and often starts around the time of the menopause. It usually affects the base of the thumb and the joints at the end of the fingers, although other finger joints can also be affected. Back and neck, the bones of the spine and the disc in between are often affected by changes that are very similar to osteoarthritis. In the spine, these changes are often referred to as spondylosis. Foot and ankle generally affects the joints at the base of the big toe. However, osteoarthritis of the midfoot is also quite common. The ankle is the least commonly affected part of the foot. Shoulder. The shoulder consists of two joints, either of which can be affected by osteoarthritis. Glenohumeral joint, a ball and socket joint where the upper arm meets the shoulder blade. And acromyoclavicular joint, a smaller joint where the collarbone meets the top of the shoulder blade. Elbow, not commonly affected by osteoarthritis. When it is affected, it often follows either a single serious injury or a number of more minor injuries. Jaw. The jaw or temporomandibular joint is one of the most frequently used joints in the body, and the cartilage in this joint is particularly prone to wear. Osteoarthritis in the jaw often starts at an earlier age than in either joints. Cause. It is still not clear exactly what causes osteoarthritis. Osteoarthritis is caused by damage or breakdown of joint cartilage between bones. Risk factors. It isn't simply wear and tear, and the risk of developing osteoarthritis depends on a number of factors. Age. Osteoarthritis usually starts from the late 40s and the incidence increases with age. This may be due to the bodily changes that come with aging, such as weakening muscles, weight gain, and the body becoming less able to heal itself effectively. Gender. More common and more severe in women, especially after the age of 50 years. Obesity. Being overweight is an important factor in its causation. Extra weight puts more stress on the joints, particularly weight-bearing joints like the hips and knees. Obesity may also have metabolic effects that increase the risk. Genetics. Family members with osteoarthritis are more likely to develop it. Some very rare forms of osteoarthritis are linked to mutations of single genes that affect a protein called collagen. This can cause osteoarthritis to develop in many joints at an earlier age than usual. Race. Some Asian populations have lower risk. Joint injury. A major injury or operation on a joint may lead to osteoarthritis in that joint later in life. Normal activity and exercise don't cause osteoarthritis, but very hard, repetitive activity or physically demanding jobs can increase the risk. Joint abnormalities. If you were born with abnormalities or developed them in childhood, it can lead to earlier and more severe osteoarthritis than usual. Weather. Changes in the weather may make the pain worse, especially when the atmospheric pressure is falling just before it rains. Although the weather may affect the symptoms of the arthritis, it does not cause it. Diet. Certain foods seem to increase or lessen their pain and other symptoms. However, the weight is more likely than any other specific dietary factors to affect the risk of developing arthritis. Osteoarthritis affects different people and different joints in different ways. But for most people, osteoarthritis doesn't continue to get steadily worse over time. For some people, the condition reaches a peak a few years after the symptoms start and then remains the same or may even improve. Others may find they have several phases or moderate joint pain within improvements in between. The degree of damage to a joint isn't very helpful in predicting how much pain you'll have. Some people have a lot of pain and mobility problems from a small amount of damage, while others have a lot of damage to the joint but few or no symptoms. If you have severe osteoarthritis, you may find some of your daily activities more difficult depending on which joints are affected. More severe osteoarthritis can also make it difficult to sleep. Diagnosis. Diagnosis is made through a review of symptoms, physical examination, x-rays, and laboratory tests. It's important to get an accurate diagnosis if you have arthritis, as different types of arthritis often need very different treatments. Diagnosis is usually based on symptoms, how and when they started, how they've developed, how they may affect your life, and any factors that make them better or worse. Physical examination, tenderness over the joint, creaking or grating of the joint known as crepitus, bony swelling, excess fluid, restricted movement, joint instability, and weakness or thinning of the muscles that support the joint. Test. There is no blood test for osteoarthritis, although the doctor may suggest you undergo tests to help rule out other types of arthritis. X-rays are not usually helpful in the diagnosis, although they may be useful to show whether there are any calcium deposits to the joint. An MRI scan can be helpful to identify other possible joint or bone problems that could be causing the symptoms. Complications. The changes in cartilage that occur can encourage crystals to form within the joint. This may be sodium urate crystals, which can cause attacks of gout. Calcium pyrophosphate crystals, which can also cause sudden severe pain and swelling. Calcium pyrophosphate crystals can affect any joint, but are more common in joints already affected by osteoarthritis. Treatment. There is no cure, so the symptoms are usually managed by mainstream medicine with a combination of therapies such as increasing physical activity, physical therapy with muscle strengthening exercises, weight loss, medications, including over-the-counter pain relievers and prescription drugs, supportive devices such as crutches or canes, surgery if other treatment options have not been effective, and dietary supplements and complementary treatments. Medications. Medications usually help to ease the symptoms of pain and stiffness. These are paracetamol, non-steroidal anti-inflammatory drugs or NSAIDs as tablets, creams, gels, or patches, capsaicin cream, and steroid injections. Dietary supplements include glucosamide, chondroitin, fish oils, and fish liver oil. There's evidence that acupuncture is effective in easing some symptoms of osteoarthritis. Massage can loosen stiff muscles, ease tension, improve muscle tone, and increase the flow of blood. Osteopaths and chiropractors manually adjust the alignment of the body and apply pressure to the soft tissues of the body. The aim is to correct structured faults, improve mobility, relieve pain, and allows the body to heal itself. Tai Chi is a mind-body exercise designed to calm the mind and promote self-healing through sequences of slow, graceful movements. Surgery is usually only considered once all other suitable treatments have been tried. Gouty Arthritis. Gout is a very painful form of arthritis caused by crystals that form in and around the joints. It's the most common type of inflammatory arthritis. It's more common in men and risk increases with age. Gout usually develops in middle age. Women usually do not develop gout before menopause. Gout causes pain and swelling in the joints, usually as flares that last for a week or two and then go away. Gout flares often begin in the big toe or a lower limb. Many people with high levels of serum urate will not develop gout. With early diagnosis, treatment, and lifestyle changes, gout is one of the most controllable forms of arthritis. Gout occurs in people who have high levels of urate in their blood. When this happens, needle-shaped crystals form in and around the joint. This leads to inflammation and arthritis of the joint. Urate is created when the body breaks down purines. In any day, about 3/4 of the urine in the body comes from the breakdown of purines produced within the body, while only about 1/4 comes from the breakdown of purines in food and drinks consumed. As urate levels build up, the body gets rid of any extra through the kidneys and in the urine. If the body makes too much urate, or the kidneys are unable to get rid of enough of it, the levels start to increase. If urate levels stay too high, urate crystals can slowly start forming. They mainly accumulate in and around firm joint tissues, such as the cartilage, but the crystals can also appear under the skin and may even occur in the internal organs such as the kidneys. When there are a lot of crystals in the joints, some of them can spill out from the cartilage into the space between the two bones in a joint. The tiny, hard, sharp crystals can rub against the soft lining of the joint called the synovium, causing a lot of pain, swelling, and inflammation. When this happens, it's known as an attack or flare. During an attack, the affected joint becomes very painful, tender, red, hot, and swollen. Gout flares usually occur in one joint. They can be triggered by certain foods, alcohol, certain medications, physical trauma, and certain illnesses. Flares typically get better over a week or two. In between flares, you usually don't have symptoms. Over time, if left untreated, the flares may last longer and happen more frequently. Some people may be more likely to develop other conditions or complications, especially with the heart and kidneys. Attacks usually come on very quickly, often during the night. The attack usually settles after about 5 to 7 days, but it can go on for longer. If left untreated, attacks can become more common and may spread to new joints. Attacks typically affect the joint at the base of the big toe and often starts in the early hours of the morning. The symptoms develop quickly and at their worst within just 12 to 24 hours of first noticing that something is wrong. Any light contact with the affected joint is very painful. Even the weight of a bedsheet or wearing a sock can be unbearable. Although gout most often affects the big toe, other joints may also be affected, including other joints in the feet, ankles, knees, elbows, wrists, and fingers. It's possible for several joints to be affected at the same time. It's uncommon in joints towards the center of the body, such as the spine, shoulders, or hips. Gout attacks are especially common in joints at the ends of the legs and arms, such as the fingers and toes. This is probably because these parts of the body are cooler and low temperatures make it more likely for crystals to form. Urate crystals can also collect outside of the joints and can be seen under the skin, forming small firm lumps called tophi. The most common areas for tophi are over the top of the toes, back of the heel, front of the knee, back of the fingers and wrist, around the elbow and the ears. Tophi aren't usually painful, but they can get in the way of normal daily activities. They can sometimes become inflamed, break down, and leak pus-like fluid with gritty white material. These are the urate crystals. Tophi can also grow within the joints and cause damage to the cartilage and bone. This can lead to more regular daily pain. When affected joints are used. Risk factors, family history. Even though the kidneys can be completely healthy, sometimes the genes inherited make it more likely that the kidneys don't flush urates out as well as they should. This is the most common cause of primary gout, especially when several family members are affected, such as the parents or grandparents. Overweight. Gout is much more common in people who are overweight. The more overweight you are, the more urate the body produces. And this may be more than the kidneys can cope with. Having high blood pressure, type 2 diabetes, high cholesterol, and fats in the blood can all lower how much urate is filtered out by the kidneys. Gender and age. It is about 4 times more common in men than women. It can affect men at any age, but the risk is greater as one gets older. Women rarely develop gout before menopause. This is because the female hormone, estrogen, increases how much urate is filtered out by the kidneys. After the menopause, estrogen levels go down and urate levels go up. Certain medications. Some medications reduce the kidney's ability to get rid of urate properly. These include diuretics and several medicines for high blood pressure, including beta blockers and ACE inhibitors. Other conditions. Several conditions affect the way the kidneys filter urate, or because they cause more urine to be produced in the first place. These include drinking alcohol, eating foods rich in purines, drinking beverages with high fructose corn syrup such as soda, chronic kidney disease, high cholesterol, and fats in the blood, high blood pressure, type 2 diabetes, and osteoarthritis. Complications. Having high urate levels and gout for a prolonged period of time can lead to other health problems, including narrowing of the arteries, which increases the risk of stroke or heart attack or other heart problems. Osteoarthritis, increased risk of developing kidney disease or worsening of an existing condition. Kidney stones, increased risk of some cancers, especially prostate cancer. Mental health problems, including depression, underactive thyroid, and erectile dysfunction for men. Most of the damage and complications can be stopped with a healthy diet and lifestyle. Diagnosis. There is no one test for gout, and its symptoms are similar to several different conditions. To make a diagnosis of gout, the doctor may ask your medical history, including symptoms, other associated medical problems, medications, and examines the affected joints. Diagnosing gout is usually straightforward, especially if you have typical symptoms of the condition, such as an attack in the big toe. Blood test. High urate levels in the blood test can suggest gout, but this will need to be considered alongside the symptoms. Imaging test. Ultrasound and CT scan can be good at spotting joint damage, crystals in the joints, and early signs of gout. X-rays are generally used to pick up the bones and joint damage caused by having gout in a long time. Synovial fluid examination. These are a good way to rule out other crystal conditions and make a diagnosis. They're done by taking a sample of the synovial fluid through a needle inserted into one of the joints. The fluid is then examined under microscope for urate crystals. Treatment. The goals for treatment include reducing pain, preventing attacks, stopping joint damage, preventing complications, treating active attacks, and changing diet and lifestyle. Losing weight helps reduce urate levels and can help stop or lower the number of attacks. Diet changes such as avoiding alcoholic beverage, soda, red meats, and organ meats such as liver, kidney, tongue. Seafood such as shrimp and lobster, sardines, and anchovies. Eat a healthy and balanced diet that includes plenty of vegetables, fruits, and whole grains, as well as low-fat or fat-free dairy products and oils. Limit foods high in saturated fats, as well as sugar-sweetened foods and drinks. During an attack, help reduce symptoms by putting ice on the affected area to help reduce swelling and pain, elevating affected limb to help reduce swelling, and resting the affected joint. The two main parts to treating gout are treating the acute attack and preventing future attacks. Treating an attack does not lower the urate levels or stop future attacks. The treatment helps manage the symptoms when an attack happens. The most commonly used drug treatments for attacks by mainstream medicine are non-steroidal anti-inflammatory drugs or Nsaids, colchicine, and steroids. In cases where one drug does not seem to be working on its own, combination of Nsaids with either colchicine or steroids is suggested. Treatments to prevent gout attacks. There are drugs available that can lower urate levels, prevent new crystals from forming, and dissolve away the crystals in your joints. They are called urate lowering therapies or ULTs. They are generally started after an attack of gout has completely gone. It can take a few months or years for the drugs to completely clear the body of urate crystals. But once they're gone, you will no longer have attacks of gout, tophi, or risk of joint damage due to gout. It is important to remember that ULTs won't stop attacks of gout immediately. You could actually have more attacks within the first 6 months of starting them. As the drugs start dissolving the crystals, they become smaller and are more likely to get into the joint cavity, triggering an attack. Medications include allopurinol, which reduces the amount of urate that the body makes. Febuxostat also reduces the amount of urate made in the body. Uricosuric drugs such as sulfenpirazole, benzpromarone, and probenecid work by flushing out more urate through the kidneys. Treatment for joint damage. For damaged joints, treatments will be the same as those used for osteoarthritis. They include regular exercise, reducing the strain on the affected joints, maintaining a healthy weight, taking pain relievers, and in severe cases, joint replacement surgery. Rheumatoid arthritis. Women are 3 times more likely than men to develop rheumatoid arthritis. In women, rheumatoid arthritis most commonly begins between ages 30 and 60. Rheumatoid arthritis is rare in men under the age of 45 years. Rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just the joints. An autoimmune disorder, it occurs when the immune system mistakenly attacks the body's tissues. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of the joints, causing painful swelling that can eventually result in bone erosion and joint deformity. The inflammation associated with it can damage other bodily parts, including the skin, eyes, lungs, heart, and blood vessels. Signs and symptoms include joint pain, tenderness, swelling or stiffness that lasts for 6 weeks or longer, morning stiffness that lasts for 30 minutes or longer. More than one joint is affected. Small joints like wrist, certain joints in the hands and feet are typically affected first, and the same joints on both sides of the body are affected. Fatigue, fever, and loss of appetite may be present. During the early stage, smaller joints are affected first, particularly the fingers attached to the hand and toes attached to the feet. As the disease progresses, symptoms often spread to the wrist, knees, ankles, elbows, hips, and shoulders. In most cases, symptoms occur in the same joints on both sides of the body. About 40% also experience signs and symptoms that do not involve the joints. Areas that may be affected include skin, eyes, lungs, heart, kidneys, salivary glands, nerve tissue, bone marrows, and blood vessels. Signs and symptoms may vary in severity and may even come and go. Periods of increased disease activity, called flares, alternate with periods of relative remission, when the swelling and pain fade or disappear. Over time, rheumatoid arthritis can cause joints to deform and shift out of place. Risk factors include gender. Women are more likely than men to develop rheumatoid arthritis. Age occurs at any age, but it most commonly begins in middle age. Family history. Increased risk of the disease if a member of the family has rheumatoid arthritis. Smoking. Cigarette smoking increases the risk, particularly if one has a genetic predisposition for developing the disease. Smoking also appears to be associated with greater disease severity. Excess weight. Overweight causes a higher risk. Complications of rheumatoid arthritis include osteoporosis, rheumatoid nodules, dry eyes and mouth, infections, abnormal body composition, carpal tunnel syndrome, heart problems, lung disease, and lymphoma. Rheumatoid arthritis can be difficult to diagnose in its early stages because the early signs and symptoms mimic those of many other diseases. There is no one blood test or physical finding to confirm the diagnosis. During the physical exam, the doctor checks the joints for swelling, redness, and warmth. He may also check the reflexes and muscle strength. Blood test. People with rheumatoid arthritis often have an elevated erythrocyte sedimentation rate, or ESR, or C-reactive protein, or CRP level, which may indicate the presence of an inflammatory process in the body. Other common blood tests look for rheumatoid factor and anti-cyclic citrullinated peptide, or anti-CCP, antibodies. Imaging test. The doctor may recommend X-rays to help track the progression of rheumatoid arthritis in the joints over time. MRI and ultrasound tests can help the doctor judge the severity of the disease. There is no cure for rheumatoid arthritis. Clinical studies indicate that remission of symptoms is more likely when the treatment begins early with medications, known as disease-modifying anti-rheumatic drugs, or DMARDs. The goal of treatment are to stop inflammation or reduce it to the lowest possible level, put disease in remission, relieve symptoms, prevent joint and organ damage, improve function and overall well-being, reduce long-term complications. Medications. Nsaids, non-steroidal anti-inflammatory drugs, can relieve pain and reduce inflammation. Over-the-counter Nsaids include ibuprofen and naproxen sodium. Side effects may include stomach irritation, heart problems, and kidney damage. Steroids. Corticosteroid medications such as prednisone reduce inflammation and pain and slow joint damage. Side effects may include thinning of bones, weight gain, and diabetes. Conventional disease-modifying anti-rheumatic drugs, DMARDs. These drugs can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Common DMARDs include methotrexate, leflunomide, hydroxychloroquine, and sulfasalazine. Side effects vary, but may include liver damage and severe lung infections. Biologic agents, also known as biologic response modifiers. This newer class of DMARDs include abatacept, adalimumab, anakinra, certolizumab, etanercept, golimumab, infliximab, rituximab, sarilumab, and tocilizumab. Biologic DMARDs are usually most effective when paired with a conventional DMARD, such as methotrexate. This type of drug also increases the risk of infection. Therapy. You may be referred to a physical or occupational therapist who can teach you exercises to help keep the joints flexible. The therapist may suggest new ways to do daily tasks that will be easier on the joints. For example, you may want to pick up an object using your forearm. Assistive devices can make it easier to avoid stressing the painful joints. For instance, a kitchen knife equipped with a hand grip helps protect the finger and wrist joints. Certain tools, such as button hooks, can make it easier to get rest. Surgery. If medications fail to prevent or slow joint damage, surgery to repair damaged joints may be considered. Surgery may help restore the ability to use the joint. It can also reduce pain and improve function. Surgery may involve synovectomy, tendon repair, joint fusion, or total joint replacement. Surgery carries the risk of bleeding, infection, and pain. Self-care. You can also take your own measures to manage rheumatoid arthritis and ease pain and fatigue. Diet, exercise, stop smoking, and mental health are keys to good health overall and controlling rheumatoid arthritis. Healthy eating. A balanced, nutritious diet consisting of the recommended amounts of all the food groups helps promote wellness and makes it easier to maintain a healthy weight. Daily movement. Even when you don't have time to exercise, try to make movement part of everyday routine. Use the stairs instead of taking the elevator. Park in a spot that makes you walk a bit to enter a building. Take the longer way to reach an appointment. Balancing activity with rest. It's important to try to stay physically active even during a flare, but rest is also especially important when rheumatoid arthritis is active and joints feel painful, swollen, or stiff. Rest helps reduce inflammation and fatigue that can come with a flare. Taking breaks throughout the day protects joints and preserves energy. Hot and cold treatments. Heat treatments such as heat pads or warm baths tend to work best for soothing stiff joints and tired muscles. Cold is best for acute pain and swollen joints. It can numb painful areas and reduce inflammation. Topical products. These creams, gels, or stick-on patches can ease pain in a joint or muscle. Some contain the medicine that you can get in a pill, and others use ingredients that irritate the nerves to distract from pain. Stress reduction and complementary therapies. There are different ways to relax and stop focusing on pain. They include meditation, deep breathing, and thinking about images in mind that make you feel happy. Massage can help reduce pain, relax sore muscles, and erase stress or anxiety. Acupuncture involves inserting fine needles into the body along the special points to relieve pain. If you don't like needles, acupressure uses firm pressure instead. Supplements. Studies show that curcumin, turmeric, and omega-3 fish oil supplements may help with rheumatoid arthritis, pain, and morning stiffness. Talk with the doctor before taking any supplement to discuss side effects and how it may affect other medicines you are taking. Positive attitude and support system. Cultivate a network of friends, family members, and co-workers who can help provide emotional support. Take time to do things that you enjoy to lift your mood, which can help reduce pain. Some common complementary and alternative treatments that have shown promise for rheumatoid arthritis include fish oil. Some preliminary studies have found that fish oil supplements may reduce pain and stiffness. Side effects can include nausea, belching, and a fishy taste in the mouth. Fish oil can interfere with medications, so check with your doctor first. Plant oils. The seeds of evening primrose, borage, and black currant contain a type of fatty acid that may help pain and morning stiffness. Side effects may include headache, diarrhea, and gas. Some plant oils can cause liver damage or interfere with medication, so check with your doctor first. Tai Chi. This movement therapy involves gentle exercise and stretching combined with deep breathing. Many people use Tai Chi to relieve stress. Small studies have found that Tai Chi may improve mood and quality of life. When led by a knowledgeable instructor, Tai Chi is safe. Don't do any move that cause pain. According to Dr. Feridun Batmanhelig, author of Your Body's Many Cries for Water, arthritis is another complication brought about by the state of unintentional chronic dehydration. The end portion of the bone is supplied by blood vessels that supply nutrients and water to the bone marrow, which manufactures the various blood cells, such as red blood cells, white blood cells, and platelets. The excess water that is being supplied to the bone marrow seeps into the joint space, and this comprises the synovial fluid or joint fluid that lubricates the bony ends that rub against each other during movement. When one does not drink adequate volume of water, this fluid becomes depleted, causing the erosion of the cartilages that cover the end portion of the bones. When the cartilages are absent, the rough ends of the bones are damaged, and when severe, creates spike-like structures that cause pain. Unintended chronic dehydration will also cause the swelling of the joint, where the edema now supplies water to the joint space instead of the normal diffusion of water from the bone marrow. In gouty arthritis, uric crystals, the metabolic waste of purine metabolism, accumulate and get deposited in the various joint spaces and tissues, the only areas where uric acid can be stored. Since urate is a neither crystal, it injures the bony ends during movement, and when the damage is severe, it causes excruciating pain. Proper hydration results to regular urination, and this helps eliminate the various metabolic waste, including urates. The alkaline minerals present in Ionique mineral drops also buffer the uric acid, and they help dissolve them and facilitate the elimination out of the body. In rheumatoid arthritis, Dr. Batmanhelig claims that any autoimmune disease is the result of unintentional chronic dehydration. During this state, the cells are not provided with sufficient nutrients for the cells to perform their daily functions, since one of the vital functions of water is to transport nutrients and oxygen throughout the body. When the cells are deprived of the nutrients they require for a prolonged period of time, the deficiency will cause the cells to go into a form of cannibalism, utilizing less vital parts of the cell that are made up of amino acids to nourish more vital parts of the cells. This state of cannibalism seems like the body getting into a state of self-destruction known as autoimmune disease. To correct the problem, proper hydration is the primary solution. Water is the most important substance for life. Water is more important for the prevention and cure of all sorts of health problems, including arthritis. You have to prudently prevent dehydration. You must not want to get thirsty in the traditional sense of developing a dry mouth before you drink. Dry mouth is not an accurate indicator of early pathology-producing thirst. A good indicator is the color of the urine. Drink enough that urine fluctuates between perceptibly light yellow to colorless. To hydrate the body properly, follow the formula 50 ml per kilogram body weight per day. The adult human body is approximately 70% water, and so the old rule that we must drink 8 to 10 glasses a day is very erroneous. After computing for the right volume of water to drink, this is the manner that one should drink water throughout the day. 1/4 of the total daily water requirement is taken upon waking up in the morning and at bedtime. 1/8 of the total daily water requirement is taken 30 minutes before lunch and supper. 1/8 of the total body water requirement is taken 2.5 hours after breakfast and lunch. Drink additional 250 ml of water for every 30 minutes of any strenuous physical activity. Drink whenever thirsty. Drink purified drinking water purchased from an accredited drinking water refilling station or water filtered through a drinking water system certified by the National Sanitation Foundation or NSF International as Class 1 for standards 42, 53, 58, and 401. The major contaminants in water are sediments, microorganisms, chemicals, and heavy metals. These contaminants must be eliminated from your drinking water to avoid any adverse health effects. Since most purification technologies eliminate the healthy minerals, they must be restored utilizing ionic mineral drops. Water without minerals is acidic and dead and cannot hydrate the body properly. For more information, you may visit www.ionicminerals.com and read my article on proper hydration. It will guide you on how to hydrate your body properly and effectively. A balance of minerals in the diet is crucial to the prevention of arthritis. It becomes even more crucial for the treatment. You need minerals to expand the volume of blood in circulation so it stays diluted and reaches all the corners of the body. Minerals also help make the inside of the cells alkaline, essential for preventing and treating various types of arthritis. Alkalinization will also prevent damage of the joint capsule, cartilages, and bones, and keeps crystals from forming. For adequate mineral supplementation, I recommend Ionic Mineral Drops, manufactured by Mineral Resources International, or MRI, because it is 100% natural, potent, ionic, and contains at least 72 health-giving macro minerals and trace minerals that provide sufficient alkaline minerals to help prevent and correct acidity. Several studies have revealed that the regular intake of magnesium, selenium, zinc, etc. have offered impressive benefits to arthritic patients. I recommend 80 drops of Ionic Mineral Drops, 60 drops of elemental selenium, and 40 drops of elemental zinc and copper daily. To avail of these elements, please visit www.ioniqueminerals.com. I hope I have discussed how proper hydration and mineral supplementation may help you manage arthritis. Should you need to learn more, please feel free to visit any of our branches and product distribution outlets. Our staff will be more than willing to assist you. If you are blessed by this video presentation, please share it with others so they may be blessed as well. Thank you very much for spending your precious time with me. Until we meet again, may the good Lord bless you all. Please stay safe, everyone. Once again, I'm Dr. Renato Paragas, the Water Doc.
We'll pause for 5 minutes for you to send your questions to us. So please